Hi, I'm Dr. Charlie Liu, and today I'm going to be talking about using steroid creams to treat eczema. So this is part 2 of a video on how to self-manage your eczema. Part 1 there'll be a link for below, and that's all about emollients or moisturizers and how to use them properly. And today we're going to be talking about steroid creams. So there are several different strengths of steroid cream. We tend to group them into 4 broad categories: mild, moderate, potent, and very potent. And today I'm just going to be talking about using the weakest one. As probably the most common one that we'll come across is this, the hydrocortisone cream, and you can buy this at the pharmacy without a prescription for relatively mild flares. So we'll start off by just talking about fingertip units and dosing, which is something that isn't very clearly explained in the leaflet. It usually just says something like spread thinly, and it can be confusing to know exactly how much to use on what patches of skin. So a fingertip unit is this, essentially. You take the tube and you go from the first joint of the finger, just the bit that has the fingernail, and you try and make roughly an even line like that across the length of the finger. And that's known as one fingertip unit. That's roughly half a gram. So 2 fingertip units is a gram. One of these tubes is about 15 grams in total. And one of these fingertip units contains enough steroid cream to cover roughly 2 hands worth of skin. So let's say that you have eczema on the insides of the elbows on both sides, and just a patch like this. It's a very common place to get it. You would apply the cream, half of it on one side and half of it on the other. That's roughly 1 hand's worth of skin, and that's roughly another hand's worth of skin. And that's how much you would need, a single fingertip unit. So there are charts on exactly how much to use. If you Google fingertip unit, usually within the first couple of search results, you will come across a table that just says torso, 7 fingertip units, back of the legs, this number of fingertip units, and that way you can know exactly how much to use. So you do want to use the fingertip unit because it helps you to dose it correctly and helps you to use enough. We probably see quite a lot of people who will use a pea-sized amount and try and spread it on quite a large area, and then it just isn't going to work very effectively. So that's the use of the fingertip unit. We'll talk a little bit more about steroid cream usage today, but a couple of conditions first. So if you have eczema in a sensitive area, like the eyelids or the genitalia, or if you're treating a baby or a toddler with eczema, then by all means watch the rest of this video and you might get some useful tips. But it is probably worth checking the plan with the GP because it might be that they want to do something different. So if you have skin that is relatively dry but okay most of the time, 95% of the time, and you only have a flare-up with red and itchy skin, let's say 2 or 3 times a year, then using this hydrocortisone cream over the counter and just treating it yourself is perfectly acceptable. If you have eczema that's more severe than that, and you find that actually a lot of the time it's red and itchy and you're scratching most days unless you use steroids, then it's probably going to be worth checking out my 3rd video, which is going to be on maintenance regimes for more severe forms of eczema. The other caveat to mention is that if you have infected eczema, if there has gotten a bacteria or a virus that's gotten into the eczema and caused an infection, then steroids are not going to be the right treatment for you. So things to watch out for in this case is if your rash is weeping, if there are little white heads and little lesions filled with pus, if there's a yellow crust, or if you actually start to feel unwell with a fever, then you should definitely talk to your GP first before starting treatment. But let's go back to the mild flare-ups. Now that you know how to dose the steroids, you want to apply the amount of cream that is correct and then let it sit there, hopefully on clean, dry skin, for about 5 minutes minimum. If you can leave it on there for about 10 minutes, that's great. And then afterwards, you apply a decent layer of emollient on top. Do use plenty, don't kind of skimp on the emollient, and try not to rub away the steroid into the wrong place. Then, of course, wash your hands, get rid of the steroid. When you're using the hydrocortisone, it's not incredibly potent stuff, so it doesn't matter if you accidentally leave a little bit on your fingertip. But in general, we recommend for people to wash it off first. And in terms of how long to use it for, I generally tell people use the cream until things are almost 100% better. And then use it for an additional 2 days on top of that. So let's say after 3 days of using it, twice a day, I would say have a look and if your eczema is almost completely better, use it for an additional 2 days, so 5 days in total. it's nice and easy to use it twice a day, so when you're at home, use it in the morning and then before you go to bed, but you can use it 3 times a day as well, and that might get things under control a little bit quicker if it's convenient for you. Now, that being said, if you have treated your eczema for 2 weeks and it's not really getting better or it's not controlled, at that point you should probably go see your GP. And it's either that we've got the wrong diagnosis and it's not eczema, or you need something a bit stronger in order to control it. So last of all, I'm going to address a common worry that people have, which is about steroid overuse and steroid side effects. So these side effects include things like thinning of the skin, prominent blood vessels, easy bruising, acne, and sometimes even systemic side effects such as weight gain, diabetes, and high blood pressure. And in the past, I think doctors have sometimes been guilty of prescribing strong steroid creams, putting them on a repeat prescription, and then not reviewing them often enough, which means that people end up using very strong steroid creams for months at a time, maybe several times a year, and possibly for many years at a time. And this is incredibly unlikely to happen. You're very unlikely to get any side effects if you're the type of person that I talked about earlier in the video who generally has maybe a bit of dry skin, but it's not red and itchy most of the time. If you're using the hydrocortisone cream for, let's say, 6 weeks out of the year, you're not going to get any side effects. It's just not going to happen. So we are talking about the people who are using much stronger steroids and using them for much longer periods of time. Now, the caveat to this is if you're using it in a sensitive area, for example, the face or the eyelids, which have much thinner skin, or if you're using it in babies and toddlers, you do want to see your GP so that you're getting the right amount of dosage and trying to avoid those side effects. So, in general, I would say, because of this awareness of side effects in steroids, we probably see more people these days who are undertreating their eczema rather than overtreating it. And undertreating it can be just as bad, particularly in young children. The reason for that is that if we don't treat the eczema properly, there is some evidence that because the skin barrier is broken down, there are allergens that can kind of get through, and it may make babies more susceptible to developing different kinds of allergies in the future, for example, food allergies. And so it is really important in those first few years, probably under the age of 4, to get the eczema really well under control. So that's the brief talk on using steroid creams, particularly hydrocortisone, to treat relatively mild eczema. In the next video, I'm going to be talking about how to manage your eczema when it's more severe than this. So if you're finding that your skin is red and itchy most of the time, or if you have young children with eczema, the next video is going to be talking about maintenance regimes, and then hopefully I'll do a 4th video as well, just addressing some frequently asked questions that we get about eczema. If you haven't checked out the first video on how to use emollients, there'll be a link for that as well. Alright, well, I hope that's been useful, and I hope you have a very nice day.